The highlights of this 2016 ASH meeting here in San Diego are mostly associated with the new development of new therapy, particularly for elderly population with acute myeloid leukemia. Acute myeloid leukemia is a disease that is a rare disease, but became frequently present in the population with aged. And now we get finally some drugs that works really well in this population without conventional chemotherapy. One of these drugs is venetoclax. Venetoclax is a drug that is called ABT-199, developed by AbbVie, and these drugs seems to work very well in a population with acute myeloid leukemia unfit for conventional chemotherapy. The data presented here are complementary to the previously that has been done at the EH meeting in Copenhagen 6 months ago. Now we presented that venetoclax plus low dose RC can give 35% of complete molecular response, and taken together with the patient who doesn't get complete response without platelet recovery, we can reach 84% of the entire population. This is a marvelous program because the drug is very well tolerated in the majority of the patients. The patients stay at home. It could be very inexpensive and it could be very nice for quality of life for the patient. That is a very important issue.
Also heard lots of research in myelodysplastic syndrome, if you have any thoughts.
Yeah, is another, myelodysplastic syndrome is another important pathology in the elderly population, particularly the high-risk population. The presentation of the initial result with another compound which is called SGI-101 was a drug that comes in the research development in a phase 3 clinical trial, demonstrating that a lot of people previously exposed with 5-ASA or decitabine, the hypomethylating agents more used in this disease, can be effectively treated with this compound, getting an additional 40% CR in the majority of the patients treated with this compound, which is another important drug that come in the repertoire of the medical doctor that would like to increase the rate of success in hypomethylating refractory population.
I also heard some news in pediatric hematology as well.
One of the drugs that are, of course, a breakthrough is the AMG compound, which is called blinatumomab. Blinatumomab is a BiTE, anti-CD90, anti-CD3, and this comes out from the initial clinical research that will be able to get 43-45% CR in the majority of the patients relapsed or refractory with a CD90 positive leukemia. Now the protocol are been moving a more sophisticated population of pediatric, but it will be very interesting to follow the development of this compound.
We heard about some new combinations, new formulations of drugs earlier this weekend, vadistoximab, talarine and CPX-351.
There are interesting issues coming from new combination of the drugs in acute myeloid leukemia. One of the drugs which is more promising is the so-called CPX compound, which is CPX-315 is a compound that can be possible to mix 5 times of RC with 1 times of daunorubicin, which is a perfect combination of the two drugs, giving a very prolonged exposure of the patient to a high level of the drugs, which can be very successful in the majority of the patients with secondary leukemia or with a high cytogenetic risk acute myeloid leukemia. The data that has been presented here in the majority of the patients over 65 years old are very, very promising. And we believe that this drug will be introduced as a backbone of the normal chemotherapy in the majority of the new program for patients with leukemia.
I suppose by way of summary, we've heard from lots of researchers that at this year's conference especially there seems to be a feeling of optimism, of great change after a long time of no advances. Do you have any similar feelings?
Yeah, of course. It was about 30 years that we don't have new drugs in acute leukemia and acute myeloid leukemia. Now the registration of pegylated asparaginase, the blinatumomab, which has been registered in a population of acute lymphoblastic leukemia. Probably for the beginning of the next year, we get also registration of inotuzumab, anti-CD22 from Pfizer. Makes very exciting the time. And venetoclax, which other drugs are coming finally at the last final point of experimental, could be some drugs that give a nice result for our patients with leukemia.